Hi, welcome back. Today we are going to see about an important topic. Yes, it is about the cardiology. It's about the ECG changes after an myocardial infarction. We are going to see it in a stepwise so it can be easy for us to remember and how we can go about it. Yes, the first stage is about hyperacute phase. It is the early phase. It happens within minutes. We can see a tall peaked T waves. It is the indication of the ischemia of the heart muscles. So this is the very easy and it is often missed by many healthcare providers. And the next phase is the injury phase where we are going to see the ST segment elevation. It is the hallmark of myocardial infarction. It is the significance of the ST segment elevation MI, and it is the most priority and it is the emergency condition. Here we have to see it in acute myocardial infarction can cause an acute injury of the myocardial muscles. It has to be taken on priority and treated at the most as early as possible. And the third one is the infarction phase where we can see a pathological Q wave in the ECG. This indicates the permanent myocardial damage which has happened because of the necrosis. And the next one, in this infarction phase, we can see the permanent myocardial muscle has been damaged, and this is developed within hours and it can take till days, and it appears in the ECG. And the final stage is the recovery phase where we can see a specific T wave inversion. This indicates the ischemia and the recovery, and it can persist from days to weeks. So this is a quick flow how to remember. We have to see the ST wave, T wave elevation, and the ST wave elevation, and the Q wave was present in an ECG. Then the final is the T wave inversion. So all these things has to be remembered when we are going about an ECG in a myocardial infarction patient. And the key ECG findings, how we can remember is, if the stage it is early, there is a tall T waves, and this is the meaning the ischemia present. And the next one is acute phase where the ST elevation happens, that the ST segment elevation, that is because of the injury to the myocardial muscles. And the next phase is the later where the Q waves are present in the ECG. This indicates there is a necrosis of the particular myocardial muscle. And the next phase is the recovery phase where we can see the T wave inversion, and it is a healing phase. It is present from hours till days. So the NCLEX pearl, what we have to remember is the ST elevation is an immediate action where we have to go about PCI, that is percutaneous coronary imaging, and intervention is being done for the thrombolysis. And if there is a Q wave present, there is an irreversible damage is already happened to the myocardial muscles. And if there is a T inversion, means there is an ischemia. But this is not as emergency as the ST elevation MI. The trick is T, ST and Q, and there is a T flip. This is always we have to remember. So this is all about this myocardial, how we have to go about the ECG, and we have to remember in a quick phase. So thank you and happy learning. Good day.